Alrighty. Well, good afternoon, everyone, and thank you for joining us today. My name is Anthony Hill, and I'm the Strategic Communications Manager with Georgians for a Healthy Future. We know your time and your reporting are valuable, and we're grateful that you chose to be here to help shine a light on what's at stake for Georgia with the passage of the new federal budget law. So this law essentially makes deep cuts to programs that are the foundation of health, food security, and economic stability for hundreds of thousands of Georgians. And it's easy to talk about these programs in terms of numbers and budgets, but behind every number is a family. So it's a parent who just wants to make sure their child can see a doctor when they're sick, a senior who relies on a few $100s a month to afford groceries, and a rural community trying to keep its hospital doors open. So at the core of this conversation are those families and what we can do to protect their health and their dignity at a time when the programs that they depend on are at risk. So today you'll hear from a panel of experts who will break down the law, including who it affects the most, what it means for Georgia's communities and the local economies, and what options state leaders have to help soften the blow. So we'll start with some prepared remarks from our panelists, and then we'll open it up to you for your questions. So on our panel today, we have Whitney Griggs, the Director of Health Policy at Georgians for a Healthy Future, Leah Chan, the Director of Health Justice at Georgia Budget and Policy Institute, Ife Finch Floyd, Director of Economic Justice at Georgia Budget and Policy Institute, and Callan Wells, Senior Health Policy Manager at Georgia Early Education Alliance for Ready Students. So thank you again for being here. And I'll go ahead and give the floor to Whitney to get us started.
Great. Thanks, Anthony. As Anthony mentioned, my name is Whitney Griggs, and I am the Director of Health Policy at Georgians for a Healthy Future. Georgians for a Healthy Future is a nonprofit policy and advocacy organization that works to ensure that all Georgians have equitable access to affordable, high-quality health coverage and care. And today I want to speak directly about how the new federal budget law signed by President Trump on July 4th will impact Georgia families who rely on the ACA marketplace called Georgia Access here for their health insurance. The law makes sweeping changes to how marketplace coverage works, who gets coverage, and how they enroll in coverage. Georgia has the second largest state-based marketplace in the country, and our state is poised to be uniquely impacted by these changes. So to just start with the numbers, this year, over 1.5 million Georgians enrolled in health insurance through Georgia Access. Over 90% of those enrollees receive financial assistance to help lower the cost of their monthly premiums. And since 2022, there have been additional enhanced tax credits in place to help lower those monthly premiums even further. And many Georgians are paying, have fully subsidized coverage, so they're paying nothing for their health insurance at the moment. The Georgians that are eligible for this no-cost coverage are low-income Georgians making below 150% of the federal poverty level, and they make up over 2/3 of enrollees currently in Georgia Access. Under the new budget law, these enhanced premium tax credits, as they're known, will expire at the end of the year. That change alone will increase premiums for Georgia families by hundreds of dollars a year for some and hundreds of dollars a month for others. For example, a Georgia family of three making $45,000 a year will see their average premium go up by $500 in a year. And for the 200,000 Georgians currently in the coverage gap who make too much for Medicaid, but too little for financial assistance in the marketplace, the law will make it even tougher for folks who may have income changes to switch in between potentially being eligible for marketplace coverage and coverage for Medicaid, leading to them becoming more likely to be uninsured. There are technical changes in the bill that impact how much monthly premiums are set at for plans, which will change how much Georgians are paying for the cost of their coverage annually on top of the expiration of the enhanced premium tax credits, meaning that the bill causes several affordability changes build on top of each other rather than working in tandem with one another, um, which will also impact the amount of money that comes into the state for our reinsurance program, which is essentially insurance for insurers, which could challenge this stability of the state's marketplace. Um, because Georgia has not expanded Medicaid, we have more low-income individuals enrolled in the marketplace or Georgia Access um, than most states. And those folks are going to feel the pain of these premium increases the most, but they'll also face new challenges such as the end of the special enrollment period for folks who have incomes below 150% of the federal poverty level. They'll be subject to paying back any miscalculations in their premium tax credits. Um, and the bill also ends auto renewals for folks who are receiving tax credits to enroll in coverage. Um, Over 75% of Georgia Access enrollees were auto renewed in their plans, just like how folks with employer coverage are auto renewed in their health insurance or their life insurance every year. The administrative burden and the identity proofing challenges this puts in place mean that many folks just won't enroll because of administrative burdens. These changes to the marketplace will interact with the changes to Medicaid and make it that much more difficult for Georgia families to get coverage. Um, so now I will hand it over to Leah Chan with GBPI.
Leah, I think you're muted.
Thank you. Sorry about that. Um, so I want to talk to you all today a little bit more about the Medicaid impacts that show up in this bill. So data show that Medicaid is already a cost-effective program, and most non-elderly adults enrolled in Medicaid or living in Georgia's health insurance coverage gap are already working, enrolled in school, a full-time caregiver, or have a disability. So the notion that this reconciliation bill somehow roots out fraud, waste, and abuse, and the idea that there's sort of a large proportion of low-income, able-bodied Georgians who are looking to game the Medicaid system is not supported by the data. And in fact, what this bill does is actually shift costs to the state, which forces the state down one of two paths. So path one requires the state pick up more of the tab. So because of this new law, Georgia will lose an estimated 10 billion in federal Medicaid dollars over the next decade. So the state could raise additional revenue or otherwise find funds to help fill critical funding gaps. Path two would require difficult choices. So the state could be forced to make changes to who gets covered and what kind of benefits they receive. So the new law cuts federal Medicaid spending for Georgia in three primary ways. So first, it limits Georgia's options for financing its state share of Medicaid by freezing existing provider taxes and prohibiting the creation of new provider taxes. It also limits the state's ability to draw down additional Medicaid funds through directed payment programs. So those funds provide a critical boost to safety net and rural hospitals that often run on razor-thin margins due to high uncompensated care costs. And lastly, the new law adds complexity to Georgia's existing work reporting requirement that over the past 2 years has really prioritized paperwork over connecting people to care and has cost Georgia taxpayers millions, most of which has gone to administrative expenses rather than covering doctor visits. So the new bill language potentially adds a new paperwork burden for newly exempt Georgians and generally adds additional pressure and bureaucratic red tape to our state eligibility and enrollment infrastructure, which is already weak and poorly functioning. So other key provisions in this new law that move our state in the wrong direction by prohibiting Medicaid eligibility for certain lawfully present immigrants and by eliminating a federal financial incentive to fully close the state's health insurance coverage gap. So taken together, what are the impacts of this new law? So, in short, rather than allowing us to progress and expand access to care to all Georgians, the healthcare provisions in the bill really threaten the health and economic security of Georgia's low-income families and really pushes Georgia's rural healthcare system to the brink. So we are likely to see reductions in access to healthcare coverage, pressure on household financial security for lower income Georgians, and greater risk of medical debt, financial strain on safety net healthcare providers, and increased risk of hospital closures, particularly in rural areas, and stress on our state and local economy with job losses and reduced economic output. So, just as an example, modeling shows that four hospitals are at particular risk of closure in Fannin, Macon, Irwin, and Washington counties. So, a closure in one of those counties doesn't just impact the folks who are on Medicaid. It impacts the privately insured older adult who has been seen in the ER when his diabetes symptoms flare up. It impacts the charge nurse who's worked at that hospital for over 20 years. And it impacts the cafe next door that stays open thanks to business from hospital patrons. So on June 27th, the Department of Community Health convened a special meeting of its board. And according to Commissioner Carlson, the department has been monitoring the federal landscape and the movement of this new bill and felt that one of the policy decisions that could potentially impact Georgians the most was the discussion around state-directed payment programs. It remains to be seen if the federal government will approve Georgia's request for almost $2 billion in additional funds for Georgia's providers and hospitals. However, what is clear is that Georgia must continue to take innovative and proactive steps, as they did at that board meeting in June, to mitigate the harm of this new law and to reject austerity and notions that somehow these cuts to healthcare, food assistance, and other life-saving programs are inevitable. So with that, I will pass it to my colleague Ife. Thank you.
Thank you so much, Leah. Hello, everyone. I'm Ife Finch-Floyd, the Director of Economic Justice at the Georgia Budget and Policy Institute. The unprecedented changes to the SNAP program and the tax and spending law present a risk of increased food insecurity for Georgians and negative impacts on local economies, especially in rural areas. The Supplemental Nutrition Assistance Program, or SNAP, is one of the most effective and efficient anti-hunger programs we have in this country. SNAP reduces food insecurity by about 30% and improves health across the board and economic security. It reaches about 1.4 million Georgians, or 700,000 households. In 2024, SNAP recipients got about $3 billion in federally funded SNAP benefits, and they use these benefits in nearly 10,000 SNAP retailers throughout the state. I'll touch on some of the major SNAP provisions in the law. So first, a lot of you have heard about this cost shift. The law disguises cuts by shifting costs to the state, like we heard in Medicaid. SNAP benefits have always been 100% federally funded. However, the new law would require states to cover a percentage of SNAP benefits based on payment error rates. I want to just be very clear, this is unprecedented, and this is a fundamental change in the structure of the SNAP program. Payment error rates are overpayments or underpayments to clients that are based on mistakes made either by the state caseworker or the client. They do not represent fraud. So starting in federal fiscal year 2028, states with error rates of 6% or greater will have to pay between 5 and 15% of the share of SNAP benefits. I just want to add a quick side note to this point. States with very high payment error rates may have a 1 to 2 year delay for this requirement if they haven't brought down their error rates, I should say. Based on current levels of spending, 5% of SNAP benefits for Georgia is about $162 million. Again, that's based on current levels of spending, and this provision will come into play in fiscal year 2028. So if Georgia leaders believe they cannot afford the new costs because they cannot or do not want to raise revenue or cut other state programs, they may reduce access to the SNAP program by increasing the administrative burden to access the program, or they may opt out of the program altogether. Additionally, the state's share of SNAP administrative costs will increase from 50% to 75% starting in federal fiscal year 2027. But let's move on to the work requirements. The law expands policies that take away food benefits for people not meeting work requirements. Previously, recipients who are aged 18 to 54 with no children or without a verified disability are required to work for 20 hours a week or an average of 80 hours a month. The new law increases the age from 54 to 64 and includes parents, grandparents, and caregivers with children who are between the ages of 14 and 17 years old. Research study after research study finds that work requirements do not increase wages significantly or increase access to quality jobs that will improve economic security. Instead, work requirements do a better job of simply cutting people off of basic assistance programs. And as we heard earlier, work requirements could be administratively burdensome for caseworkers and clients, and really just don't align with the realities of the low-wage labor market, which is very volatile. And in rural areas, many jobs just simply are not accessible or available. Many families could lose some or all of their benefits for not meeting this requirement. Now I'll touch on just a few other provisions. So like Medicaid, the law ends eligibility for many immigrants with humanitarian protections. The law limits how much SNAP benefits can increase by freezing future increases to what is called the Thrifty Food Plan. Now, the Thrifty Food Plan is a USDA-defined plan for a nutritionally adequate diet at a very low cost, and SNAP benefits are based on this Thrifty Food Plan. It was reevaluated in 2021, 2022 for the first time in about 50 years, and subsequently SNAP benefits increased. However, this law says the Thrifty Food Plan can be reevaluated, but SNAP benefits will not be adjusted accordingly. The law also eliminates the National Education and Obesity Prevention Grant Program, also known as SNAP-Ed, which provides nutrition and obesity prevention education throughout the state. SNAP-Ed provides funding to the Georgia Department of Public Health, state universities, and other nonprofits who provide nutrition education to people eligible for SNAP benefits. So I'll pause there and pass it to my colleague, Callan Wells.
Thank you. Good afternoon. My name is Callan Wells, and I'm the Senior Health Policy Manager at GEEARS, the Georgia Early Education Alliance for Ready Students. We advocate for policies that support Georgia's youngest children from birth to age 5 and their families and caregivers. You've heard today about how this reconciliation package would affect Georgia's economy, hospitals, farmers, and public health system. I want to focus on what it means for our youngest children. Let me start with a story. Last year in Gwinnett County, a baby girl, I'll call her Lizzie, was born with stage 5 renal disease. She spent months in the hospital before learning about and applying for Katie Beckett Medicaid, which helps children with complex medical needs. Medicaid covers medical bills incurred in the 3 months prior to application, coverage that protected Lizzie's family from overwhelming debt and made it possible for her to continue the therapies she still needs to grow and thrive. Now let's consider what would happen under this bill. First, the bill shortens that retroactive coverage window from 3 months to 2, potentially leaving families like Lizzie's responsible for tens of thousands of dollars in medical bills before their child even leaves the hospital. Second, it delays rules that would streamline Medicaid applications and renewals. Because of the complexity of the current process, many children lose coverage temporarily, causing critical disruptions in care during a child's most important developmental years. Third, as Leah mentioned, Georgia has seen several hospitals close over the last decade, both rural and urban, due to the burden of uncompensated care. Now imagine being a parent of a medically fragile newborn, only to learn that the nearest hospital is no longer open. Fourth, the bill could prompt cuts to SNAP benefits. The Urban Institute estimates that 121,000 Georgia families with children could see reductions. That affects food security, health, and long-term outcomes for kids like Lizzie across the state. This bill has far-reaching implications for children, not just because it could harm them directly, but also because children live in families and communities. Children rely on the adults around them, parents, teachers, neighbors, extended family, to keep them safe, healthy, and fed. While the bill may exempt parents of young children from work requirements, it does not shield the broader network of caregivers who help raise them. In other words, when adults lose access to healthcare or nutrition support, children also experience that loss. I know none of us want that for Lizzie or any of Georgia's youngest children. At GEEARS, we believe that children are only as healthy and secure as the people who care for them. And we urge Georgia's lawmakers to keep children at the center of this conversation and to protect the programs that help them thrive. Thanks, and I will hand it back to Anthony.
Thanks, Colin. And thank you to all of our speakers for helping to explain the human impact of these cuts and what they could really mean for Georgia. We know these are complex issues, but at the heart of it is really about making sure Georgia families can get the care they need when they're sick and put food on the table. That's the promise that programs like Medicaid, SNAP, and the ACA were designed to keep. We've covered a lot of ground. Now it's time to open up the floor for your questions. This is an opportunity to dig deeper into the data, the impacts, and options available to state leaders moving forward. We see we already have a question from Ariel in the chat. So Ariel, feel free to come off of mute and we can direct it from there.
There we go. Sorry about that. Thank y'all for doing this. So question for Leah. I've seen the same figures that you're citing, and especially I'm thinking about the ACA exchange, Georgia Access. And thank you so much for doing the dollar figure estimates. Two questions. Number one, the estimates is that something that you've seen from looking at the early filings from the insurers on the exchange? Because I know that I think some of them are already in, not all of them yet. Or is that just like an estimate that you guys did scientifically using your own forecasting? So that's the first question. The second question is, every time I do a story on this issue with Georgia Access, the ACA exchange, I run into the very specific Georgia reinsurance program. And so I want to double check of whether you guys factored that in. Like, is reinsurance going to solve everything? Thank you.
This is Whitney with GHF.
Oh, thank you, Whitney.
Yeah, no problem. The estimates on the premium increases are not from the rate filings. I have not seen them yet. They're based on 2024 data that CMS released on the average tax credit and then the average enhanced premium tax credit that folks received. So it's not quite as granular or accurate as the rate filings, but it's probably about as close as we can get. And to kind of hit on the other kind of component of that is that all of these changes will impact premiums, and we just don't know what that will look like. You know, that's just from the enhanced premium tax credits alone. And then from the reinsurance, for the reinsurance question, reinsurance is definitely not going to solve everything. And because of our reinsurance program and how successful it has been, Georgia's actually particularly at risk from these changes and the impact they could have on our reinsurance program and lowering the amount of money that we get for reinsurance. So it's kind of it is a helpful program to lower premiums across the board, but it's definitely at risk due to these changes, and that's pretty unique to Georgia.
So did you take the reinsurance impacts into account when you were making those dollar figure estimates for the premiums?
I did not take the reinsurance program into account, mostly because it's hard to pin down
Yeah.
what the potential impact could be, and if the state will make any investment to help shore that up.
Okay, thank you.
All right, I see a question from Sophie in the chat.
Yeah, hi, thank you all. I really appreciate your insight. So, in just thinking about what's happening sooner rather than later, I think that's a big question that folks have when we're thinking about the provisions in this bill. So, as I understand it, the expiration of premium tax credits that would potentially come at the end of this year, right? And then, if I'm missing anything on the Medicaid side of things, kind of what's happening sooner rather than later. And then for SNAP, how should people start thinking about their benefits, today, tomorrow, or is it something that they're just going to have to kick down the line until we see some of these effects start happening?
I can start off with the EPTC question. That is correct. The EPTCs will expire at the end of the year, and insurers have been asked to submit 2 rate filings, one for if the EPTCs stay in place and one for if they don't. So we will see those premium increases as soon as 2026. And then some of the marketplace provisions we'll see in the 2026 plan year as well, either from the bill itself or because of newly finalized rules from CMS that mirror what's in the bill.
Sophie, thank you so much for your question. So there were a few different provisions on the SNAP side of things that did not have implementation dates, which essentially means that they are in effect upon enactment. So that includes the restrictions on certain immigrants, for example, and even the work requirements. In short, it's unclear what is happening at the state, particularly around immigrants, in terms of informing people about eligibility. And I think we really are waiting to see if USDA has any guidance for states. I think the states are waiting for that as well, because they are technically in effect, but practically speaking, it's not state governments don't operate like a light switch, right? And can automatically kind of change policy immediately. In terms of the work requirements, those have to be considered whether somebody, one, is in kind of that bucket of those expected to work or not. That has to be considered during the application process and during the renewal process, which happens around, or kind of the periodic check-in, periodic report process, which is usually 6 months after someone starts receiving benefits. So it's really at those points in time where people are informed that they might be subject to these new and expanded work requirements. But in short, we don't have much more details about immediate implementation beyond that.
Okay, so it's possible that some folks might be maybe having those conversations now if they have those check-ins, but we're not.
I can't say. And then the other piece, so the big cost shift, right? The most kind of the most costly probably portion of all of this does not start until fiscal year 2028. So that's October 27 in terms of calendar years. And sorry, getting a little technical, but a state can use either the payment error rates from 25 or 26. And the 25 error rates, they're going to be kind of selecting that data just in the next few months. So what a state can do to lower their payment error rates, that they don't really have as much time as it might appear in the law. And then if there was just to be quite frank, there was a carve out for a senator from Alaska. And that is why we have this kind of delay for states with high payment error rates. So for example, if your payment error rate is, when you multiply that by 1.5, and if that equals 20%, getting really wonky here, but if that equals 20%, you are a payment state that has a delay. If that's based on 2025 error rates, the delay is to 2029. And if that's based on 26 error rates, the delay is to 2030. So it's really kind of choppy about how all of this can roll out. Georgia's payment error rate would, as it stands now and from 2024, is quite high and would meet that threshold of a potential delayed kind of start date if it maintains that very high level. But really what this kind of carve out does is actually create an incentive for states to have high error rates in order to delay that start date even more. So it really kind of goes against, I think, what some of the authors might have been trying to do in this law.
Okay, thank you.
Sure.
All right, I think we have Margaret and then Brianna.
Hey everyone. Thanks for hanging out with us this afternoon. I'm Margaret Coker in Savannah with The Current. I wanted to try and drill down a little bit more about timeframes and timelines for Georgians who are going to be looking to re-enroll in ACA plans this fall and before the end of the year. So policy moves at the speed of a snail sometimes. Obviously, there's a lot of business at stake for insurers to be able to get to retain their customers. So can you guys walk us through what the time frame looks like for the next 6 months in terms of when is going to be crunch time? When are the rate premium estimates going to be out by insurers? When will policymakers, if they want to try and keep us from falling off this cliff, when would policymakers have to actually get serious about trying to extend premium tax credits for ACA plans?
Yeah, that's a great question. And unfortunately for Georgia consumers, we are in that crunch time right now. Final rates need to be submitted actually this week. So again, insurers have been asked to submit two separate rates. One for if the EPTCs are extended and one for if they're not extended. And ideally, Congress would have indicated that they're interested in extending them by now, so insurers would have felt a little bit better. Final rates, though, picking one of those two rates has to be done by September at the latest. So even if Congress decided at the very last minute to extend the enhanced premium tax credits, the premium shocks would already be felt for the 2026 plan year. So thinking about what do the next 6 months look like? We are in that time right now. And when Georgia Marketplace consumers, Georgia Access consumers log on to Georgia Access to start window shopping for plans, or when their plan starts sending them information about their plan for the following year, they will see significant premium increases in there. And let me know if that doesn't quite get to your question.
Nope, that was great. Thank you very much.
All righty, Brianna.
Thank you. I just have two quick questions. How did you all know this was going to specifically affect Georgia? Were there any, types of data that you all took or getting any calls? How did you all know this was going to specifically affect Georgia?
For the marketplace provisions, we've been using the estimates from the Congressional Budget Office about coverage losses, and I've also been using the data that the Kaiser Family Foundation has put out, and just knowing again, because Georgia hasn't expanded Medicaid, how many low-income Georgians are in the marketplace. Was able to look at a few different data points to get a better sense of how many Georgians would be impacted by the bill.
Okay, thank you. And my second question is just what advice would you all give to Georgians that will be going, if they'll be going through it with this new budget?
I would think one thing for Georgia voters would be to reach out to their legislators. Again, I think a lot of what we talk about today puts a lot of pressure on our state budget. And so our state lawmakers are going to have to make some decisions about how they move forward. And it's critical that we sort of don't accept sort of the inevitability that hundreds of thousands of Georgians are going to lose access to healthcare coverage and food assistance, and instead encourage our lawmakers to use all of the tools at their disposal to raise additional revenue and fill some of these budget holes. Just as an example, we have been operating with a budget surplus that is above and beyond our undesignated reserves. So our state has clearly shown that we are, setting our revenue estimates very conservatively, and there might be an opportunity to use more of the state revenue that we're receiving to meet people's basic needs. So that might be an opportunity for folks to reach out to their state lawmakers and let them know that they want their state lawmakers to fight for Georgians when it comes to these cuts in the state budget.
Thank you.
And I'll add for folks with marketplace coverage to really be proactive about looking at plans for next year. Reach out to their health insurer, ask if they're anticipating any premium increases. For folks who are auto re-enrolled, they'll still be able to auto re-enroll in 2026, but would really encourage folks, instead of auto re-enrolling this year, to look and see what plans may best fit their budget, and really start to think about how the cost of coverage may shift in their family budgets for the next year or a few years down the road.
Ready. Sophie, I see you have another question.
Yeah, sorry, it's a quick one. Where can we see the insurer rate filings when they come out?
That's a great question. The Department of Insurance may post them. I don't know what timeline in which that will happen. Some states publicly release their rate filings. For example, we've seen Massachusetts, Colorado, I think Oregon have already released their rate filings. So we can kind of get a sense of nationally how much they're increasing. And then the National Association of Insurance Commissioners also holds the rate filings, but you need to have access to that. Yes, that is mostly what I was getting at, that it's probably an open records request.
Okay, thanks.
Alrighty. We have time for one more question if there are any more. All right. Well, thank you for the thoughtful questions that we did get and for spending time with us this afternoon. Of course, if you have any questions after the call, feel free to reach out to me or another comm staffer from one of our orgs to follow up. So we hope today's briefing has given you the context and data that you need to tell this story, not just as a policy debate, but as a question of how we can care for one another as a state. And if you need additional data, follow-up comments from any of our speakers, or help connecting with the folks that are impacted, please feel free to reach out to us. We will be sending out a recording shortly after this call, if not today, tomorrow morning. Then again, thank you again for being here today, and feel free to reach out to us if you need anything.